Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, today's message is on the effect of SGLT2 inhibitors on blood pressure. All of you use SGLT2 inhibitors for diabetes, but they also have an effect on blood pressure. I'll comment on it. I will also comment on ARNIs and the effect on blood pressure. Many of you use ARNIs for cardiovascular disease, namely heart failure, but they also have an effect on blood pressure. So today my comments are on SGLT2 inhibitors and ARNIs on blood pressure. SGLT2 inhibitors and ARNIs are not approved for the treatment of hypertension, but they have a major effect on blood pressure. All SGLT2 inhibitors like EMPA and DAPA have been shown to lower the blood pressure by 6 to 10 millimeters of mercury. So one of the things that you see when you give an SGLT2 inhibitor for the treatment of diabetes is the blood pressure actually goes down as a result of SGLT2 inhibitors, and you may have to adjust the dosages of other antihypertensive drugs. A number of studies have shown an effect on blood pressure from SGLT2 inhibitors, which is a good thing, and you have to keep an eye on it. But if the blood pressure is coming down a little bit more than what you expect, then you have to adjust the dose of other antihypertensive drugs. Similarly, when you give ARNI for patients with cardiovascular disease or for heart failure, the blood pressure comes down to some extent. 5, 6, 8, 10 millimeters of mercury. Not sure, but the blood pressure does come down. So ARNIs have an antihypertensive effect, although they are not approved for hypertension. So if the patient is receiving an ARNI for cardiovascular disease, heart failure, you may have to adjust the dose of traditional antihypertensive drugs so that the blood pressure does not go down too low. So in summary, ladies and gentlemen, the drugs that are not approved for hypertension, namely SGLT2 inhibitors and ARNIs, have an important effect on blood pressure. So they have a blood pressure lowering effect, which you may have to monitor and manage the patient appropriately, and if necessary, adjust the dose of other antihypertensive drugs. Very interesting phenomenon of so-called additional effects from SGLT2 inhibitors and ARNI on blood pressure in patients with diabetes and in patients with heart failure. An interesting phenomenon. These drugs are not indicated for hypertension, but they appear to have an effect on blood pressure that's quite beneficial. And I wanted to give that as a message for today during the hypertension month of May.